This is a summary of the new Personal Health Information Act, or PHIA, which came into force in June 2013. The Personal Health Information Act is provincial legislation under the Nova Scotia Department of Health and Wellness. The Act and its regulations came into force on June 1, 2013. It brings under one piece of legislation many of the laws, policies, and codes that currently apply to personal health information. It was developed to work with both paper and electronic records and to address not only information related to your direct health care, but areas that support your care, including research, planning, and management of the health system, and quality of care. The Personal Health Information Act applies to your personal health information collected, used, and disclosed by a custodian during the course of providing you with or supporting your health care. PHIA only applies to your personal health information about your physical and mental health that can identify you or that contains information that could be identifying, for example, your health card number. It does not apply to health information that is de-identified or that is statistical. For example, if you have diabetes and your hospital releases information about the number of people with diabetes in your city, that information would not be protected under PHIA because it is statistical and cannot identify you. PHIA only applies to your information in the custody or control of a health provider designated as a custodian under PHIA. Custodians include the district health authorities and the IWK Health Centre, regulated health professions such as doctors, dentists, and psychologists, licensed nursing homes, and the Department of Health and Wellness itself. It also applies to the agents of a custodian, including the custodian's employees and volunteers. Finally, PHIA applies to personal health information managed by custodians in the course of providing or supporting health care. Health care is defined in the legislation to include health promotion, protection, prevention, treatment, and maintenance of your physical and mental health. It also includes palliative care and the dispensing of drugs. PHIA brings together many of the rights you have in relation to your personal health information while adding rights to ensure greater protection of your privacy. It confirms your right to request access to your personal health information or to view a copy of it. It also confirms your right to request a correction if you believe your record is not accurate, complete, and up to date. It introduces your right to request what is called a record of user activity, a list of the people who have looked at your health information on an electronic information system. And it requires custodians to inform you if your information has been lost, stolen, or subject to unauthorized access. If you believe that a custodian has not followed the privacy requirements in PHIA, for example, they have lost some of your personal health information but did not report the loss to you, you may make a complaint to the custodian about the incident. And if you are not satisfied with the custodian's response to your complaint, or with their response to an access or correction request you have made, you may contact the review officer for PHIA to ask for a review. PHIA also outlines responsibilities for every custodian to help protect the privacy of your information. A custodian must review your request for access to your information and consider your request to correct it. A custodian must make available materials to advise you of how they may use and disclose your personal health information. A poster and brochure that would outline if they plan to disclose it to other health providers involved in your care or to the Department of Health and Wellness for payment for health services provided to you. A custodian must also implement safeguards to protect your information, including secure access to areas where your records are stored and passwords for all electronic information systems that they may use. PHIA provides avenues for you to request a review of a decision made by your custodian. For example, if you discover that your dentist has lost your dental records and has not informed you, you may make a complaint to him. If you are not satisfied with his response, you may contact the review officer for PHIA to request a review of his decision. And if you wish to take the issue further, you may appeal to the Supreme Court of Nova Scotia, who has the authority to review your case and levy penalties. This presentation was intended to give you a general summary of the new Personal Health Information Act. This is not a comprehensive discussion of the legislation, but a summary of your rights as an individual and information on how custodians will manage your information. For more information, please visit the Nova Scotia Department of Health and Wellness website. The website includes a video covering PHIA in more detail, a toolkit for custodians with chapters on the major issues in the Act, and templates for key requirements under the legislation, and frequently asked questions about key issues in PHIA. If you have general questions about PHIA, you can contact the Nova Scotia Department of Health and Wellness directly by email or by using the toll-free inquiry line listed above.